This is the first of two videos on food poisoning and will discuss the causes. The commonest cause of acute diarrhea is food poisoning, and the patient will usually recover within 3 to 7 days. Sometimes acute diarrhea may be due to antibiotics and food allergy. Symptoms of food poisoning include stomach or abdominal pain, diarrhea, fever, nausea and vomiting, tiredness, as well as symptoms of dehydration, including dry mouth, passing little urine, fast heart rate, dizziness, and confusion. Food poisoning is an illness that happens eating food that contains germs such as bacteria, virus, or parasites. Once in the body, the bacteria reproduce by dividing themselves, so one bacterium becomes 2, and then 4, and then 16, and several million in 8 hours, and thousands of millions in 12 hours. This means that if a food is contaminated with a small number of bacteria and it is left out of the fridge overnight, it could be seriously contaminated by the next day. Food poisoning can be caused by bacteria, either by producing a toxin inside the body or by invading the intestine. Food poisoning due to bacterial toxin usually occurs within 6 hours of taking the contaminated food, and vomiting is a common symptom. Food poisoning that occurs more than 6 hours after consuming the contaminated food is usually due to a bacteria. Bacteria usually infects the large intestine, and sometimes it may cause blood in the stools with fever. Food poisoning due to virus also usually occurs more than 6 hours after taking the food. Viruses usually infect the small intestine and cause a lot of watery diarrhea with vomiting. Fever is rare. The two common viruses that cause food poisoning are norovirus and rotavirus. Norovirus is usually transmitted through food handlers, contaminated food and water, shellfish, and contact with contaminated surfaces, especially in toilets. The vomit and diarrhea of patients is highly infectious. There is a vaccine for rotavirus, but no vaccine yet for norovirus. Salmonella is a common cause of food poisoning. Salmonella is commonly found in the intestine of animals. Food poisoning is usually due to exposure to raw or half-boiled eggs, uncooked meat or poultry, or cross-contamination between infected raw meat and fresh vegetables and fruits. E. coli is a bacteria and is a common cause of food poisoning. It is commonly a cause of food poisoning in travelers and is called travelers' diarrhea. It happens after travelers consume food or untreated water contaminated with fecal material, especially when they visit countries with poor water and sanitation standards. Another common cause of food poisoning is a bacteria called Campylobacter. It is found in poultry and raw meat, and spread is similar to Salmonella. Some people get joint pains in ankle and knees after a Campylobacter food infection. Fortunately, most people recover without treatment. Another rare but serious complication is severe muscle weakness on both sides of the body, which occurs about 1 to 3 weeks after the infection. This happens in about 1 in 1,000 people. This happens when the immune system attacks the nervous system after a Campylobacter food poisoning. And this condition is called the Guillain-Barré syndrome, and is life-threatening if the patient doesn't get prompt medical care. Another common cause of food poisoning is a bacteria called Staphylococcus, which is found in the skin, especially boils and skin infection. It is often spread through unhygienic practices by food handlers. Another bacteria called Bacillus cereus is a common cause of food poisoning from rice and other cereals. When heating kills the bacteria, the spores, which are heat resistant, survive. Spores is a form of the bacteria that is resistant to heat. For example, if rice is kept too long at room temperature, the bacteria can regrow from the spores and release a toxin causing food poisoning. So it is best to keep such food as cooked rice in the fridge, as the spores cannot grow in a cold environment. This food poisoning is quite common in takeaway foods. So what are the common foods that cause food poisoning? Poultry, which includes chicken, duck, or turkey. It has to be well cooked. Raw or half-cooked eggs, which may contain salmonella. Undercooked meat, for example, a steak that is done rare. Unwashed fruits and vegetables, including fruit juices. Raw sprouts like bean sprouts and alfalfa. Raw or undercooked shellfish like clams, mussels, oysters, and scallops. And algae on shellfish produces a toxin, and sometimes shellfish are contaminated with viruses like norovirus or bacteria. Raw honey may contain a toxin produced by bacteria. Raw flour may contain germs. That's why raw flour or batter should not be tasted. Cooked rice that has been sitting for too long at room temperature can be infected by the bacteria called Bacillus cereus. Ready-to-eat meals like pre-packed sandwiches and deli meats. Sushi and sashimi can pose a risk for a variety of reasons, including parasitic worms and contamination by food handlers. And finally, unpasteurized milk. These are some of the examples, like steak rare or done blue rare. Sushi and sashimi, as is shown here, and ready-to-eat meals like deli meals, which are often displayed for a considerable amount of time in restaurants or supermarkets. Other common causes are raw or half-cooked eggs, which may contain salmonella, and raw or undercooked shellfish like oysters, which may contain viruses like norovirus and bacteria.